Yeah, thank you very much. So I'm going to first just give a brief about Breast Cancer Hub because there are many who are new to our organization who have signed up from across the globe. So we are basically BCH is a GuideStar Platinum certified organization. It's a 501c3 nonprofit registered in North Carolina, USA. And our vision is save lives by awareness, volunteering, education, and research. And we focus mainly at the grassroots sustainable solutions so that, we believe that even if we can save one life, we save a family. And I'm Lopa Mudra Dasra, so I'm the founder. And everything that I do is a full-time pro bono and voluntary because I always believed that there are simple things that can help, which is mainly focusing on early detection and prevention of cancer. And that's how the inception of the organization started in 2017 in September. Our tagline is, we always believe coming together to fight against the disease. So together we save lives. And the reason I always feel that why the late detection with breast cancer, because women do not speak about it. And how can we make women across the globe, mostly in the developing countries where our culture is a culture induced inertia. So that's the reason why I have been speaking about breaking the breast taboo because that's the way I feel that we can bring this change and women can speak up, men can speak up because men get breast cancer too. And with men, the scenario is worse than women because men feel it's a woman's disease and they're more shy to talk about it. So saying that, I would just like to go over the mission of Breast Cancer Hub. We equally focus on women and men with breast cancer, and we also stand together against other cancers through our BCH Wings Cancer Hubs with the different missions, awareness, education, and scientific seminars that we conduct, and community outreaches and the cancer screening camps. But when we do that, I give my WhatsApp number, my email, everyone has access to that. So if they have any issues, they reach out. So we navigate the suspicious cases towards the healthcare facilities with proper follow-up so that we know that they are being taken care of. We are adopting villages, like penetrating deeper, going to each member, each household, maintaining the database and follow-ups. And I'm so proud of our project coordinator and our field workers. We have adopted 11 villages in Assam in Northeast India, an amazing team we have, and we take care, we monitor and manage each patient individually. Our support group and counseling is amazing. We provide scientific analysis of the cancer diagnosis and treatment. We publish the stories and interviews of the cancer advocates in the local languages because I always felt that a lot of times women are not even, so they're so scared of the word cancer, but when they see other women talking about, the survivors talking about in local languages, which they understand, it gives them the impetus to fight and, conquer cancer. And that is so important. Our global, we have many different global support groups, but we have one very important, a private WhatsApp group. If you know someone struggling with the disease, please let us know. It's a very private group. We do not discuss in any social media. So we are, for me, the patient privacy is the utmost important thing. We have a patient treatment bucket, which is the underprivileged populace in poverty, especially in the developing countries. For research, we bring the true scenarios and data by penetrating into the untapped sectors so that we can help with substantial, impactful scientific results. And our research work, clinical data analysis, and epidemiological research study. The proposal is approved by Institutional Review Board, IRB USA, and ISC India, where we collaborated with, I don't know if Dr. Rakesh is here right now, so I'm so thankful to Dr. Rakesh. So we are collaborating with St. John's Medical Hospital, and that's how we got the ISC from India, and I'm so thankful to Dr. Rakesh for that. Our leadership programs, I mentor. My thought process is that we need to inculcate the art of scientific thinking and thought leadership in the students because they can spread the word in their own network, and also in that way we are helping with their career too. So our leaders execute the impactful roles. Our funding, we are very transparent. Ethics and integrity is the foundation of our work. And the donations are only from the kind-hearted souls, and every penny counts. All our services are free of cost, and all donations strictly driven towards our mission. We always have everything uploaded on website. So we are going to upload the financial reports of 2020 in this month itself. So if anyone wants to look into it, you can just click here and you can see all our reports. So that's all about Breast Cancer Hub and its inception and our mission and goals. And I want to really give a shout out to all our, all the family members of BCH volunteers across the globe who have come forward, stepped up to, spread the word about early detection, prevention, and helping us to execute our mission. And I want to welcome each of you here today who has, come here, given your time on a Sunday morning or Sunday night to listen to our speaker. And hereby, I want to introduce you to our amazing speaker. We are so thankful to Renuka Hari for her time today. And she is the founder of Santulan Massage in Charlotte in USA. She's a licensed massage therapist and board certified at national level. She's a preferred practitioner with Society for Oncology Massage. She has been a massage therapist for 12 years now. She has been actively practicing oncology massage along with manual lymph drainage for 8 years, breast tissue health for past 2 years, and oncology esthetician doing skincare for 5 years. She's also trained in infusion center massage. And today she'll be talking about oncology massage, what it means, who is it for, and how it can benefit a patient. She will also talk about breast tissue health and how one can take care of it, both women and men, with or without cancer, in simple, easy steps that you can practice at home. Thank you so much, Renuka, for your time today. And we all are so excited to listen to you. And everything is recorded. The session is recorded. So once I share it to you all, please share it in your network, because even if we can help anyone going through the phase, or even it's for anyone without cancer too, because it's like more of a preventative measures too, right? So Renuka, over to you. If you would like to share your screen and start today's session. Thank you so
Sorry. What happened here? Okay, stop that.
You can stop sharing now, and you can
I'm not sure what happened here.
So you can, would you like to, I don't see you either, Renuka. So would you like to go to the video mode?
Yeah, I am clicking on it, but nothing is happening. So I'm just.
So maybe do you want to close the,
There we go.
yeah, it's perfect. We can see the screen now.
All right.
Okay, and we don't see you. So if you would like to come to the video mode, please.
There we are.
Yes, yes, everything is good. Thank you so much.
All right. Thank you so much, Lopa, for giving me this platform. And thank you to all the attendees for giving up your precious time on a Sunday morning, afternoon, evening, night, wherever you are. So thank you so much for that. I'm here to talk about oncology massage, its importance and benefits. And it is very, very important as to why this needs to be happening.
You
Why?
have to go to the next screen. So
Yeah,
you
that
just
is
have
what
to
I'm
click.
trying to do, but it is kind of frozen here. So,
Or maybe what you can do, Renuka, you can exit the full screen and you can just go to the next slide. If you exit full screen, that might be easier for you then.
no, I think I'll have to stop share for a
Yeah,
moment.
that's fine. Yeah.
Let's stop share and
Thank you, our audience, for your patience. Yeah. So if you go to share screen again.
there we go. Are you able to see the screen?
No, we are not. Yeah. We just did right now, right before around 9:45 a.m. So just do the share screen, Renuka, and then you can see that. Yes, perfect. It's happening. Yes, good. So maybe we can just, if you want to go to the full screen, that's perfect. Otherwise, if you think that that's stopping you from going to the next slide, I totally leave it up to you.
I am going to do the full screen here, but
Yes.
is this a full screen? End show.
No, that's end show. So if you just go to, I can see so many buttons open for you. So if you show all that, close the screen there, maybe then you'll be able to see. At the bottom. Yeah, so now do you see the full screen? Or if you can go to the next slide, that's totally fine, Renuka. You can just start it, yeah. Can you move to the next slide?
Yeah, sure. Are you able to see the slide?
Yeah, we are able to see the slide. So that's what I'm saying. We don't need to have it in full screen. You can just go to the next slide and you can start your presentation. Yes.
All right, so here we are. Thank you very much. I'm Renuka Hari, and as you can see, my number is there. Like Lopa is available on WhatsApp, so am I. And if you have any questions that cannot be answered by me here today, please feel free to reach out to me via text, and I'll be happy to answer to the best of my ability. I am a certified provider with S4OM, that is Society for Oncology Massage, and I'm also certified as a cancer-aware comprehensive massage therapist. I've been doing this for 8 years out of the 12 years that I have been a massage therapist, and this is something that I'm very passionate about, and I have a whole lot of information for you. So I just want to get started. So let's just do that. Uh, the very first question, what is oncology massage? Now, this is a massage that has been specially modified to accommodate the needs of those affected by cancer based on clinical considerations. It is not something like where somebody just walks in through the door and you have them lie down on the table and start working. No, there has to be a lot of information that needs to be gathered even before we touch the body. For example, this is my general intake form. This is like 5 pages long, and this is just for a regular massage. If somebody wants to come for, say, pain relief or just to relax or do whatever. But if the minute I hear the word cancer, or if I see that in this form they have mentioned cancer, I have another 2 pages worth for them to fill out. And what does this involve? This involves information about the site, the skin conditions that might have come up because of the treatment, about any pressure. By pressure, I mean, is there any bone fragility? What about the blood cell count? Any peripheral neuropathy? Positioning. Do they feel any fatigue or shortness of breath, any chills happening? Is there a loss of balance? What about any medications that are being administered to them? Anything else, like say immunosuppression that's happening, low white blood cell counts? All these are very, very important for us to know, and so that we can do the right kind of thing. One of the main things in oncology massage is that it requires both immediate and long-term adjustments. Now, if somebody is is currently undergoing active treatment for it, the body might not actually feel good. But the thing is, and they might also be thinking, oh, massage is like a lot of deep pressure, deep work. But no, there are many ways that we can modify it and many ways that we can actually help the patient heal and recover faster. And long-term adjustments also need to be made because people are thinking, oh, I'm done with the treatment, so I don't really need anything to be adjusted anymore. I can get on. But there are some flare-ups that can happen, and I will be talking about it further down the line. And so I hope it'll all make sense as we go along. So, and like it can be, for whom can it be done? It can be done in active treatment, for those who are in recovery, and for those in survivorship. So here are some main clinical considerations. Obviously, the compromised areas. It is very, very important to have that in play in the therapist's mind at all times. There's no, going around this. We have to make sure where is the area compromised, what kind of treatment are they getting, is it a combination of treatments? Is it only chemo, or is it chemo and radiation and something else that may be administered to them? What stage of treatment are they on? Have they just started? Or is it an ongoing thing? Or have they recovered? What is the length of treatment? How many weeks are they into it? And any side effects stemming from all this. And by stage of treatment here, I also mean what is the stage of cancer? What kind of cancer do they have and what stage is it at? Here are some additional important considerations to keep in mind while giving an oncology massage. First of all, peripheral neuropathy, that means numbness in hands and feet. How does that affect massage? Now, if the extremities are cold and you're not feeling any sensation, if I ask you for a feedback, you might not be able to give it back to me, especially if I'm working those areas. And for many people, they find that the medications have affected their ability to hold onto things, how to grasp things, or even when they're walking, they feel like the sense of balance is off. So if I'm working on that, on say somebody's feet or the hands, and they're not able to give me proper feedback, then yes, I might be putting too much pressure, which might compromise something else, like say the bone pain that I've mentioned over here. And we don't want that. What is the level of fatigue? Are they feeling tired all the time, or do they feel well rested and good enough to carry on their everyday life? What about the blood cell count? What happens? How is that? Is it at the good levels that is needed, or is it too low, or is it not good enough? Bone pain. Everybody feels this at some point or the other. That has been my observation. And so when giving an oncology massage, we are not putting a lot of pressure on the skin, on the body. We have to make sure that the way we touch them, we are always very conscious about it. And we are always very present and active, and to check in with the patient often as to how the pressure is, trying to get feedback from them. And quite often patients are surprised because they're like, the pressure is, you can go deeper. Like, no, you can't really. And I will explain to you in a minute when I start doing the demo, for which I'd like you all to join in, as to just how little pressure is needed in order to get effective results. It's actually very surprising. Medications, what kind of medications are they taking, including any herbal supplements, any vitamins, medical devices? So let's say somebody has a port, which is normally put in here on the right side, just below the collarbone, and now they have to lie face down. Will that port impact how they lie? Yes, because there will be pain and pressure when they are lying face down. And yes, so some things have to be taken into effect for that. How are adjustments going to be made for that? Brain fog. Brain fog is also another very real thing that is faced. There's often confusion, there's a loss of memory. You can feel distracted and feel kind of out of sorts at all times, or at sometimes they forget that they have an appointment. And it just affects different people differently. And these two, the last two ones, the lymph node removal and lymphedema, almost everybody who has had cancer has lymph nodes removed, even if it is to do a biopsy, because that is the very first step that most medical practitioners do, to get a biopsy done. And the lymph node removal affects how the lymph moves in the body. As you can see in the picture, the lymph nodes are like this, and it's almost like a chain. So the fluid moves from one node to the next and to the next, and then it starts to go down towards the heart and the spleen. And so it forms a chain. So if one of them is taken out, and it's very rarely just one lymph node, it's usually quite a few of them. So you can see how this chain is disrupted. And so that's why it is very important to keep that in mind, and where it has been taken out, and how lymphedema can result because of that. Let's move on to the next one. And this is stuck again. Let me refresh that. Okay. Are you able to see this, Lopa?
Yes, we are, Renuka.
Okay, great. So I hope this will reset this, whatever. So what are the risk factors that can trigger lymphedema? First of all, trauma. Even surgery is trauma. It's a very deliberate trauma done to the body, obviously. Liposuction, anybody having any kind of body contouring and lipos, any kind of injury. Sometimes we get hurt and we see a bump, and on the bump, we also feel like, okay, it feels very squishy. What is that squishiness? That is lymphedema that's accumulated over there. There's lymph that is accumulated, and the swelling is called edema. Any inflammation of any kind that happens in the body, because that's how the body draws our attention that, hey, something needs to be attended to over here. Any cuts and blood draws over here, sorry. Heat, friction. Now, massage is all about rubbing, right? So that is a certain kind of friction. And that's why we use some kind of medium, a lubricant, to make our hands glide smoothly. And the reason why we don't want to do any deep work is because that creates an extra um, friction and rubbingness, and we don't want to bring any redness into the body. The redness shows that we have gone too deep and that the skin is now being affected, and we don't want that to happen. Um, heat from hot tubs, saunas, hot showers, steams, any burns, sunburns. You feel the weather is nice. I want to go and lie on the beach and, or in my garden and just lie there and enjoy the sun. But if it's causing you sunburn, then yeah, you've probably gone too far. And you might not realize it because the lymphedema can happen even a few days down the line. For some people, it happens right away. But if it's happened a few days down the line, you might not even connect the two events together. Okay, yeah, it happened because I was lying there on the beach that day, and today I have lymphedema. Puncture wounds. People who are, let's say you go to have your blood test done, if they know your health history, they will know how to draw the blood safely in a manner to not cause, because they have to bind your arm at one point, right? In order to draw the blood, to make the veins bulge a little bit. But you see, because bone density can be compromised because of the medications that have been administered, and that makes it very difficult um, for the blood to be drawn. It's also difficult to find the veins sometimes because they have been repeatedly poked, especially in the elbow area, and that makes it very difficult. But those who are trained in drawing the blood from cancer patients, they are actually very skillful in that. And they make sure that it's done in such a manner as to not trigger any lymphedema. It's not to say that it cannot ever happen, but they try to minimize the risks as much as possible. Even insect bites, cut cuticles. So if you are trimming your nails or your cuticles and you can get cut, yes, it can trigger lymphedema because of that. Thorns and tattoos. You like gardening, you're out there clipping your bushes, and most people do wear gloves, but sometimes, yes, you can still feel the effect of a thorn or two. And yes, getting tattoos. That can trigger lymphedema because it's a repeated um, um, needle that is going around the skin, putting dye in it. And so, yes, it can trigger lymphedema. Constriction, like I mentioned, blood pressure cuff. Restrictive clothing. Restrictive clothing, well, since I had mentioned this to Lopa, since we are having quite a few Indians here in our audience here today. So let's talk about sari blouses. You can see how it's a very form-fitting garment. It's very tight, especially around here. And this is where the lymph nodes are usually. They're here around the armpits, they're here at the collarbone, and they're here around the down below in the hip crease and the groin area. So you can see how the sari blouse, if it's so tight that you can barely do a good range of motion with it, how it can impact and cut in and press down into the lymph nodes. And also here at the elbow where the blouse ends, here where the sleeve ends, it's normally very tight over there. and it's preventing the lymph from moving up from the elbow crease. There are nodes here also around in the crease of the elbow. So it's preventing the lymph from moving up and into the shoulders where it actually needs to drain. And so I would advise anybody who is wearing anything tight to avoid doing that. And that includes heavy back straps and bra straps as well. I have worked on people where I see the bra straps have left their marks on the skin, and over the years, it's actually left a deep groove over here, and the marks around the body as well from the straps is still there even after a whole 1 hour of session of working on them. So that is really not good. It just shows that everything is moving very, very slowly in the body, and if possible, go braless. I mean, you are home. Most people are still working from home. Wear double layers if you have to, but preferably try and go braless as much as possible, and try to avoid clothing that's very restrictive or cutting into it. And by constrictions, I also mean things like rings and watch straps. We don't think of these things, but if your ring is so tight that you cannot pull it off your finger, then yeah, it's blocking some lymph flow over there. Watch straps, bracelets, socks on your feet. If they're leaving a mark around the ankle, then yes, some lymph might be accumulated over there. Overexertion. Even simple things like, say, you're gardening, but you lose track of time, but you enjoyed it so much. So we don't think that it's going to do anything to our body. After all, exercise is good, right? You're bending, you're clipping, you're reaching for things, you're picking up and shoving and mowing and doing all these things. But over time, or maybe at the end of the day, or maybe after a few days again, the effect of that can be felt on the body, especially a body that's been affected by cancer, and it can trigger lymphedema. Changes in elevation. This is a very common feature if you're flying, or say, even if you move from the planes to say even a few 100 feet, change in elevation, that can trigger lymphedema. And most people are aware of this, and they usually take compression socks with them when they're flying, and to prevent that, and also to move around in an aircraft. When most people are sleeping, it's perfectly fine to keep walking up and down the aisle so that the blood gets moving, and to keep doing some exercises. In fact, now most airlines, if you see in the airline pocket, especially for long distance flights, they have a little information sheet that tells you how you can move and how to keep the circulation going by doing some ankle rotations, or pointing and flexing the feet, or to rotate your shoulders, and all of which helps to keep the blood moving. Diet high in sodium. So if you're eating packaged foods, they usually have some hidden sodium over there. So high sodium, which is high in salts and preservatives, that can trigger lymphedema. We Indians love our pickles, and I know that they're wonderful and very tasty, but it's best to have it in small quantities. And if you can, you just wash it off and then just eat the piece if you want, because it's already soaked in so much of salt, and that's a better way to consume it, I would say. Only also because kind of the mouth tastes kind of bland and flat taste in the mouth. So you want to eat something that is spicy, but whatever is spicy is also offset by the salt in it. So you have to find the right kind of balance with that. Excess body weight. Most people who have been diagnosed with cancer do their best to get rid of the excess body weight, and for obvious reasons. So the less weight there is, the faster you can recover. Here are some things that has to be borne in mind. In fact, goes for all cancers. I came across this picture and I wanted to share this with you. Just looking at the therapist's hands, you can see how much pressure she's putting on the body. And obviously, the way we are trained is to push everything up towards the heart. So that's where the hand will be moving up this way, up the spine. And what if this person on the table, just for example, has not mentioned that she has had cancer or has had lymph nodes removed from, say, either her left side or the right side? Then what happens? Now, this therapist is just going to push everything, all the blood and the toxins and the flow, everything is going to end up in either of these, both sides or maybe on one side. So so you can see how important it is for the person lying on the table to convey to the therapist what their health history is all about. Um, Here are the additional factors. First is obviously age. It's done a little differently for the pediatric patients than it is for adults. The pressure is very light and yet it is firm in touch. And the kind of pressure I'm going to talk about is just take your hand and place it on your wrist. And you're not pressing down, you're just placing it over there. And then you try to drag your hands up and you see how that feels. That's it. You're just letting the weight of the hand do the work. That is the amount of pressure that we'll be using. And when we put a medium, a lubricant, like say an oil or lotion, it glides that much more easily. And that is what I want to convey, that just having this light of a pressure is still very effective. The strokes, what kind of strokes are we using? We usually try to use long gliding strokes if they are an active treatment. For those, if the pain is manageable and if the patient can tolerate it, we can go a little bit deeper, just a little bit deeper elsewhere in the body, but never in the compromised areas. Compromised areas, we have to be ultra careful and very present as to what we are actually working in and how we are working that area. The direction of the stroke, that's what I mentioned. The direction of the stroke is always away from the compromised areas. And because let's say, for example, her left side over here has been compromised. We want to push everything into the right side so that as to not overload the left side, the lymph nodes on the left side. And that is important because the side is not functioning properly. So now the other side will try to make up for it. And that's just the nature of the body. So we want to help that happen. The positioning. What about the positioning of the body? Is it comfortable for them? If they have any medical devices, we want to make sure that nothing is pressing into the body. We also want to make sure that the body is supported by means of bolsters or rolled up towels or whatever. So the feet have adequate support at the ankle. They feel like they're not able to take the arm back to have it lie around them. Make sure that even all that is being supported by, say, rolled up towels, or even I have all kinds of special bolsters and cushions all around this my workspace over here, and I use them all as needed. Any breaks needed? It's very difficult for most people to be lying still for long periods of time, especially when the average time is, say, about 50 to 60 minutes. That can be very difficult, and they might need to take a break. And most places, especially spas, they don't accommodate that. Because let's say you get up to use the bathroom and then come back, you also have to wear your clothes and go back and then again come and take off the clothes. So it's all cutting into your time. And I don't really bother about that. I just give them the full time for as much as possible. And here are some questions. What to ask your massage therapist? How long have you been a licensed massage therapist? This is assuming, of course, that you want to get an oncology massage, and or rather, even with any therapist, if you want to get a massage, ask them questions. Don't just go by what is there on the website. Call them up and ask them. How long have you been a massage therapist? Are you licensed? Is the massage based on your client's health history? If I have gone to places where I was given a postcard to fill out, And I'm thinking, how is this even relevant? They have not asked me for anything other than my name and address and my email. So they're obviously just gathering information. And I'm like, I don't know if I want to go here anymore. Have you had any oncology massage training? If so, for how long have you been actively practicing oncology massage? Now, here is the thing. We are required to do a certain number of continuing education units every few years. And most people just do it because they want to get the credits. But there are very few of them who actively practice whatever it is. Like I have done close to 80 hours in just oncology massage alone. I first started with 24 hours and then I did another level of that. So which I did under 24 hours. And every year I do at least 1 or 2 hours. And just now in January, I did a 3-day workshop again with with the same school where I had done my foundation course in oncology massage, and I learned again. It refreshed me so much that yes, on one hand, it assured me that all that I've been doing so far has been good and it's on point. But on the other hand, I also got to meet other people because it was all done virtually. Um, and also got to learn a whole lot more that I now know I can incorporate into my practice. So just make sure that whoever you go to is passionate and very knowledgeable about what they're doing. Now, how long is a session? 30 minutes, 60 minutes, 90 minutes. I leave it to them to decide. My average is usually 60 minutes, but there are times when it has extended to 90 minutes just because they need breaks or they're not able to move from one side to the other just as fast. They need help. Then again, when they turn to the other side, again, you need to prop them up with bolsters and things like that to make sure that they're comfortable before you can actually start doing a massage again. Now, do you have an adjustable table? Most therapists keep the table. They have what we call as a standing table with just wooden legs. So the legs can be adjusted, but again, most therapists don't do it. I have an electric table where I can adjust the height just by pressing on a lever for that. So it's adjusting the height. I can also adjust the tilt, so I can raise the head in such a manner that they are like semi-reclining over there. And I have different kind of bolsters to prop up, support the knees or the ankles as the need be, so that they are lying in a well-supported position. And here is another question. Oh, can I get deep tissue? I have been fully recovered for so many years. I've never had any symptoms. I get all my checkups done regularly. Um, no, not really. I can do deeper work, not deep tissue, but deeper work elsewhere in the body, but not in the areas you've compromised. Because once that area is compromised, it is compromised. Those nodes are not there anymore. It's not like the node is going to grow back. It doesn't happen that way. So I can do deeper work elsewhere. But here is the thing. They are often feeling the pain or the discomfort from in the area that has been affected. And so that's where they want you to kind of get in there and pull it all out. And I'm like, that's not how it works. I cannot just dig in there and pull it all out. That is not what deep tissue is. Deep tissue is working deep into the tissue. It does not mean deep pressure. But the two are often misinterpreted mainly because of the way it's been marketed and promoted, but that's not how it's done. And I tell them I can get in deep without causing pain. But first, you have to help the body relax in order to get into the tissues. You can't just rub a body and then start digging in. That is not how it works. What about hot stone massage? Now, I've already, hot stone massage is a big no-no. I use therapeutic heat here and there, usually moist towels, which I place just to help the body relax and maybe soften up the skin and to bring some blood flow to the area. And it usually feels good. But to do a full body hot stone massage, no, I would not advise that. Why? Because again, heat can trigger lymphedema. So while in that moment it might feel good, But if they are not drinking adequate water, and if they are not, following a sensible diet, it can really have a detrimental effect on the body. Let's say, I can't say detrimental, I'll say not so positive effect on the body. So it's basically undoing everything that the hot stone massage is supposed to be doing for the body. I often need breaks. Can that be accommodated, or will that be cutting into my time? I always say yes. And I always ask them to bring a robe with them so that they're not putting on all the clothes and going in, to the bathroom and again coming back. So it just makes it that much easier for them. How often do I need to get a massage? Well, that depends. That depends upon your pain level and how often can you come. Usually, if you have lymphedema accompanying, then I will say twice a week. Why twice a week? Because we flush the body of the lymph and then it comes back. Because lymph is also manufactured in the body just by the metabolic activity that's happening. So lymph is basically it's a protein-rich fluid that is given out by the cellular metabolic waste, and it gets trapped between the cells in the body because it's moving very slowly. But eventually it drains into the blood, and the blood brings it all back into the heart. But the thing is, its very nature is to move very slowly, and it's a protein-rich fluid. It has all the cellular waste, it has dead cells in it, debris, and all that. So think of it like a clogged drain. It's just moving very slowly, and you need some help in flushing that out. So, how often do I need a massage? I cannot tell that over the phone. I often have to see you in person. Why? Because massage is all about touch. We have to touch, we have to feel, we have to figure out what is going on, how is the body working, what is the body able to do, what is it not able to do, and what are you looking for from a session. So all that determines a session. Now here I want to talk a little bit about breast tissue lymphatics, um, because, well, Lupa's platform is a breast cancer hub, and so I thought I'll add a little bit about breast tissue lymphatics. Not just about breast tissue, but anywhere in the body. As long as you're consistently stimulating and flushing the tissue, it'll help with the lymph drainage, but also with other things. In the breast, there's some people may be having cysts or tenderness in the breast tissue and or pecs, if it is for the men, and any congestion in the surrounding areas as well, like say the arms or maybe in the abdomen. So why is it in case of breast tissue or in any side, it's always important to compare one side with the other with regard to the size, the shape, any temperature. Does one side feel overly warm compared with the other? Any unexplained rashes or bruises? And in case of in case of breast tissue, is there any nipple retraction? Any discharge coming from the nipples? Any pain, lack of sensation? Um, and even the puckering of the areola. That's also something that needs to be kept in mind. And you will not know, frankly. Here is the thing. We all just go through the motions, right? When do we touch our breast tissue? When we are having maybe a shower, we're just going through the motions. And then when we are lotioning up. But beyond that, we don't really do anything. But how will you know when something is wrong? Only when something shows up on your medical screening. But what if you were able to touch the tissue on a regular basis and know, which I'm going to tell you what to look for, and know how to deal with it? Then would you be able to keep the tissue healthy? And let's say something has already gone wrong in the area, then would you be able to help it feel better? Yes, you would. So why? Because you're constantly touching it. You will know, okay, yeah, that day this was fine, today it is not. Or last week, this was hurting so much and now it has come down considerably. And you'll know that only because you are constantly touching and you're feeling it. And I will talk a little bit more about that. And here is how the breast tissue lymph nodes are. All three sides. It's actually very well protected and it is very well drained as well. So you can see it's clustered here in the underarm area and then it kind of moves out. It's following the collarbone and then it's coming down. And it likes to keep it free of congestion and disease, but we often wear tight constricting garments, so it is not allowing the breast tissue to move. So if you were moving, for women, especially if you were moving braless, then how is the breast tissue moving? It has a sway and a movement of its own, and we don't allow that to happen by wearing bras. And this is something that I wanted to share with you and do a demo on. So I'd like for you to do this on yourself. So if you have some lotion handy or some body oil or whatever, please get that. We'll just wait a minute or so while you get it. And
So Renuka, I have already emailed everyone to keep it handy. So I'm sure everyone must be having it with
oh,
them.
okay.
So you can, yeah, you can continue, please. Yeah,
So,
thank you.
all right. So let me grab some over here. And I want you to feel for your collarbones over here. You can feel this bone that's running this way all along. That's a collarbone, and it comes and meets up here in the center. And there's a little notch over here. That is your clavicular notch. And it's the sternum, which is the breastbone that is attached over here. It's a flat bone that comes, and the breast tissue is attached to that. And so this is where we will be starting. So I want you to take your hands and keep it open. And we are going to do this in the number 1 position. So we're just going to keep your hands right here. So one hand is on this side of the collarbone, the other one is here. And you're just going to pull very softly and slowly towards the center. Very softly and slowly towards the center. There should be no redness on the skin. And the reason why we are using this is there are tons of lymph nodes over here, like I showed you in the previous picture, or over here, and they're all going to be draining down towards the heart. And this is one of the main things. So let's say even if you had a swollen leg or a swollen arm, this would still be the starting point for that. Why? Because again, everything is draining down towards the heart and we have to clear the channels. So we start that by doing this here. So by clearing this, we are creating an uneven pressure in the body. So we have now cleared this, and now let's say something is swollen over here. All this has no choice but to move further up along the line. So you've seen how the lymph nodes are, they're all like linked together. So if one part is cleared, now all this will start to move. So one part is cleared, all this will start to move. So that's the idea behind this. So we're doing this as number 1. Then number 2 is to just join the underarm area, right here, the shoulder joint to the collarbone. So we are going to just move that. You can reach inside and just pull it along very gently. And the oil is so that the skin doesn't turn red. The skin here is much thinner. The skin here, right here in the upper pecs, the neck and the face is much thinner on the body than it is elsewhere. So we don't want, and it turns red very fast. So we don't want to do that. We want to be very slow and very gentle. The slower you go, the better it is. And you will have to do some 10 to 15 strokes in each position. This is the number 1 position. This is the number 2. And you want to be doing that very slowly. And here is the number 3. Now, if it is available to you, you're going to take your hand and just place this here in the underarm. Let me adjust the monitor. You're just going to take your hand, place this here in the underarm, and you're just going to press up. You're going to press up towards the collarbone. So you're going to press up. But if it's hurting or painful, please don't do that. I will show you another way to do that. And also if it's hurting to bring the arm around like this in order to do it, please don't do it. I will show you again how you can get to this number 3 position by just doing that. So again, it is like 10 to 15 strokes in each position. Why so many strokes? Because lymph moves very slowly. And we want to convey the message that we mean business, that we want things to move. 10 to 15 strokes is giving me plenty of time to see what is going on over here. Is there something happening? Is there any unusual bumps or lumps along the way? And if so, what could it possibly mean? And because is it an inflamed lymph node, or is it something else? So now the very first picture that you're seeing over here, that is suitable for everybody. But what if you have nodes have been compromised? So let's take the right side, and I'm going to put these over here on my right, just randomly, to show where all the nodes might be compromised. So now all this side is compromised. So how am I going to do the flow? We're going to start with the same. We're going to be doing this. Position number 1. And for the position number 2, you're going to come to the opposite side. We are not going to be doing anything over here. Although let us say if this moved up, then you might not be able to do, but if your nodes that have been compromised are much lower, then you can still do this action on both sides. And then we do the number 2 on the unaffected side, the side that is not compromised, and then follow it up with the number 3. Now, here is the thing. What about the actual breast tissue itself? So in the breast tissue itself, you can divide the breast tissue into 4s, like a quadrant. And the affected side, you're just going to push everything towards the center because that's where all the lymph nodes go. So you're going to push everything this way. For men, it's a little easier because their tissue is flat and it's more muscular. It's all pecs. For women, the breast tissue is fatty. And so you might have to like lift up your breast tissue in order to push everything to this compromised side. Now it's important, if this side is compromised, it's important that you don't bring everything up here because these nodes have been affected. So it's important that you drain everything down and around because those nodes continue all the way down to your abdomen. And so it's important that you bring everything down and around. And don't forget to lift the breast tissue at this point as well. And you do that. So by dividing it into quadrants, you are kind of making sure that you have not overlooked any area and that you're covering everything as needed. So you're just moving everything out. And the same thing from the side as well. Whatever you do to one side, you have to do to the other side as well, because that gives you something to compare it with. So just because this side you cannot, let's say somebody is coming to me and saying, I cannot move this arm. So in order for me to know how their arm is actually moving, I will ask them to move the other side first. How is this moving? So let us see, because now this is the relatively normal side. So how is this moving? So let us see how this one works, and let's see what this one is doing. So now I have something to compare it with, right? Does it make sense? So yeah, so once this is done, so don't forget to also flush this side over to the center as well. And here, since nothing is compromised, you can always do the same 1, 2, 3 that was done earlier, and you can press and think. Now, what if this side you're not able to bring your arm around? Then this is what you do. You do this chicken wing action. And if you put a hand here as you're doing this, you can actually feel the muscle moving. And that shows the lymph is moving. Lymphatic movement is based on 2 things. One is muscular contraction, the other one is hydration. That's why I said, please keep water handy. Because if you have done these actions properly, you will feel thirsty. And that's how you know the lymph has moved. So you need to drink water and then again continue with that. Now, let me put all these on the left side and show you. It is pretty much a repeat of how things are on the right side. but just in case, I'll just show you again. So this is the left side, and these are the nodes that have been compromised, and they usually find them here or there. So you're still going to start with the same number 1. Now, if this feels too much for you, if you're not able to do this action, you can also keep one hand on each side and just follow the collarbone along and just pull it down very gently. And here is number 2. You're going to pull everything up and over on the side that is not affected. And here is number 3. Press and release, press and release, press and release. And whatever we do on one side has to be done on that side. Now you cannot do a press and release, but you can still do the chicken wing action and it'll still move things up. But you can also help these nodes by pulling everything down and under. So help them drain that way. Lymph responds very well to manual manipulation. So that's why it is so easy to move it. It's just that it's very time consuming because it moves very slowly. So it has to be done very slowly and in a very patient manner. But the results are well worth it towards the end. Here are some do's and don'ts as we are approaching the end of this presentation. Do check with your physician if MLD, that is manual lymph drainage, is okay for you or not. Hydrate well. Why? Because lymphatics depends upon hydration and movement. That's why move often. Whatever you can or cannot do, convey that to your doctor. They have a whole team. They're interested in your well-being. They have a whole team dedicated with you. The nurse navigators are just awesome, and they get it right away what your where to help you and how to help you. Track your water intake, especially if you're taking medications. You want that medications to move through your body well, and tracking water intake is important. I always tell them, if you do not know how much water you're taking, take the bottles and keep them aside. Fill up your bottles of water. You should be having at least 8 to 10 ounces per glass times 8 glasses minimum. That is the very minimum. It's a little different for each person, but that's how much it is. And if you're not sure, ask your doctor, how much water do I need to drink every day? Visually inspect your breast tissue in different positions. You can do the standing like I showed you today. It can be done lying down as well. Look for changes in size, shape, temperature, any rashes, unexplained bruising, nipple retraction or discharge. And please don't wait till something comes up and shows up on your health report. Please be proactive in how to take care of this. And this is a very good way of being proactive. Don't press on any inflamed nodes. So now as you're doing, if something starts to feel tender somewhere, even if it is the unaffected side, please bring that to your doctor's attention right away. Okay, don't focus on any one area. And since I mentioned breast tissue, that's why I put that here. Now, don't focus on any one area, but instead of the whole breast tissue. Breast tissue is actually not just the globular part of the breast. It actually starts here from the collarbones, and it ends here below the breast tissue at the diaphragm, and it includes all the sides as well. So don't just focus only on the globular part of the breast, because most cancer is actually found over here around the tissue, not inside the breast tissue as such. And don't do any manual lymph drainage if you are having any acute inflammation, any congestive heart problems, certain autoimmune conditions, etc. So that's why you see why it is so important to have request so much of information, because all this will determine how to work the body. So again, what's going on? Here we are. And what are the many benefits of oncology massage? Pain management is the number one reason why people come and get it, because that just drains the body, and everybody wants to be functioning well. And massage is a wonderful way of helping the body reduce its pain level. When pain goes down, inflammation goes down. When inflammation goes down, better sleep patterns happen. When sleep is happening, we are also moving a lot of lymph, because even in sleep, we do toss and turn. And the body is getting its rest. Lymph drainage is happening because of massage. Scar tissue management is happening. Sometimes I just have enough time to just go to the scar, just go to the scar tissue and just keep working that, just so that they can get the uh, body part moving the way it should be. And why? Because they have managed everything else. They just want that scar tissue to be gone, because they can feel like the push and pull of the muscle, like it's not working properly. Better range of motion, better body awareness. As you're touching your tissues and working them, you develop a heightened awareness of what is working for you and what is not working for you. You have a support network. A massage therapist is supporting you and your body in a very positive manner. And that again means improved immunity, because you're pushing all the lymph and all the cellular waste out in a timely manner. And if there's improved immunity, it also means faster recovery, um, which means you are able to move along with your ADLs, that is activities of daily life or daily living. It just, again, overall quality of your life just went up in such a positive and beneficial manner. Why all this? Because you got a massage, and that is the power of touch. Just one session can help with so many things. It just keeps on moving, like a snowball effect, and that's all keeps happening. Any questions? We've come to the end, and I thank you all for your time. So, any questions?
Thank you, Renuka. Thank you for the wonderful presentation. If you would close your PowerPoint, then we can open the session for Q&A.
Okay.
Or if you would like to keep it open, that's fine. I mean, so we have a question, Renuka, that was really
Yes.
wonderful. So we have a question from Dr. Sandhya,
Yeah.
who is an oncologist, a breast oncologist surgeon. She said, what about people with a bilateral mastectomy?
Yes, the bilateral mastectomy, they can still do this 1 and 2 positions. They can still do that, because it has not affected anything over here in the sternum. And that's why I always say that massage is one field where I cannot tell you any how to do it randomly without touching and palpating the tissue. But even with bilateral mastectomy, they can very much reduce that, because even if one side is affected, they've probably chosen to have a bilateral mastectomy, just to offset the body and to keep it even on both sides. And I see that a lot. And yes, this one thing over here, doing the number one position, constantly draining it, helps a lot. And yes, if this is compromised, they can always push the lymph down towards the hip, because that's where the next level of nodes are. But just by doing this one, just doing it over here also helps drain the lymph this way. Why? Because medications often puff up everything in the face as well. And so all that swelling and inflammation in the face comes down as well. When the lymph nodes are draining from here along the sternocleidomastoid, this is the SCM. There are lymph nodes in the front and at the back on both sides. And when that is draining well, the taste in the mouth also improves. So just doing this one area over here, number one, has a fantastic effect on the body. But then again, drink water, start doing this 15 to 20 strokes. And it is so easy to do. It can be done anywhere. You can do that when you are, say, watching a presentation on a webinar. You can do that, say, if you're driving and you're stuck in traffic. You can do that when you're watching your favorite TV program. There really isn't anything much. You can just keep doing this. But so, yeah, thank you
Wonderful.
very much. Yes, bilateral mastectomy is tough, but I have seen great results, because sometimes when I'm working on the patient's breast tissue itself, I have them take their hand and I have them start to work over here. And at the end of the 60 minutes, they feel like a completely new person.
Wonderful. Thank
So
you so
thank you for
much,
the question.
Renuka.
Yes.
Hopefully, Dr. Sandhya, we could address your concern. I think Dr. Rakesh, you had a point being made. Issues of patients after axillary clearance and MRM are different. They need a different approach for reducing the upper limb lymphedema. So, Dr. Rakesh, are you here?
Yeah, I am here. I am here.
Okay, okay. So would you like to discuss something, or if Renuka can answer your point? And before going to there, I would like to mention, Renuka, that we are getting great feedback for your wonderful session.
Oh, thank you.
And, like everyone loved it. And we have learned so much, especially with the breast tissue lymphatic strokes, even without cancer, how we need to take care of our breast tissues, and, how the preventative measures of lymphedema with different parts of the body, how you mentioned about the socks and everything. Those things do not come to our mind all the
Yes.
time, right? So thank you so much for sharing your expertise and knowledge. And also someone requested, like Shraddha, who is a BCH India ambassador, she requested if we can get a copy of the manual. Maybe that's a great point. So Shraddha, we are going to post it, the session will be posted in the YouTube. So you can share it with everyone you would like to. And also we will see, I will talk to Renuka and see how we can work on the manual part. All right, that's a great point. And Dr. H.K. Das, thank you so much for your great feedback. We are really thankful to each of you and everyone here for your, thank you so much, Hussein. Thank you, Saurav. Saurav has a question too. So we will, first of all, maybe we'll start with Dr. Rakesh, and then we can address the other questions, Renuka. Yes, Dr. Rakesh.
Renuka madam, it was a wonderful talk.
Oh, thank
So I basically work on breast cancer patients in our center. So the issue basically we concentrate not on the breast edema, and I think most of the breast surgeons agree that breast edema is not an issue actually we face. We face the problem of upper limb edema. Actually, it works there. It affects their day-to-day activities,
you.
especially people from middle class family who are actually working in farms or working in areas where they have to use their
Limbs every day. Yes.
limbs every day. The upper
Yes.
limb edema is the one which is more problematic rather than breast edema. So I was just thinking, do you have any solution for that?
Yes, I do. So let me put these things back. So again, I'm just going to use this right side as an example.
Yeah, maybe would you like to close your, or do you want your presentation to be up for Renuka, or you want to it's
No,
totally up to you.
I think I can just show this. It's
Okay, perfect. Yeah. Okay,
and,
great.
uh, so let me just show this. So I said that, okay, if this side is compromised, you can still do this number one position because it'll pull everything across. Now, if they're having, say, a swelling on this side, now how to do it? Now, this is how you do it. You have to bypass the affected nodes. So you're going to, again, bring the arm up and over from behind the shoulder, and you are going to drain it over here. So if somebody were to raise this, you can see how it forms a little hollow over here. Now there are a lot of lymph nodes, not just the nodes, but even the lymphatic ducts, they actually drain into this area on both sides. So you have the right lymphatic duct, you have the left subclavian duct, and so that's why it's important to not put too much pressure in these areas, and the light touch is what is needed. So if one side is affected, you bring the hand up and around. You're not going to do with the whole arm. You have to like break it up into little segments. And so first you always start from here, the top of the shoulders, and you're going to bring it right into this area. And then again, use your hand as a measuring guide. And then you go to the next area, and then you're going to combine that and again bring it here. Then you move down again, and then you're combining all that you previously worked, and then like that. So you keep moving up in stages. And why do you do that? Lymph moves very slowly, and it's not just that you can do 1 or 2 strokes. You have to do 15 to 20 strokes in each area before you move down to the next. because it moves that slowly. And the thing is, the arm is always down. So it helps if the arm is raised up, and that may be difficult for them. Why? Because the arm is heavy with lymph. So it makes it difficult. So it's important that the arm is rested. So let's say somebody is lying down. So prop up the arm on pillows or whatever so that it's raised a little higher than the heart, just a little bit, and that'll help the lymph flow so much better. So it is good if somebody is there to do this for them so that they are not overworking this side. Because like I said, overexertion is also a factor in increasing lymphedema, and we don't want that. So it's best if somebody else is doing this for them, and this is how they can do. I can again do a whole different presentation on this in just different body parts. And if you want that to happen, just let Lopa know. I hope that answered your question, Rakesh.
Um, Probably next time we will have a detailed discussion on that area specifically. Now we will continue with the
Yeah, you can also reach out to me, and I can show
yeah,
you, in a different, maybe a face-to-face call, how to do that.
yeah, sure.
And
Thank
guide
you.
you through that. Yeah, absolutely.
Yeah. Thank you. Thank you so much, Renuka, and thank you, Dr. Rakesh, for your question. And thank you, Hussein, for your feedback, and everyone over here. So I want to get into, we would like to get into Saurabh's question.
Yeah.
So let me just pull it up because there are many coming up. Sort of, are you here? Yes, I got your question. So then I'll come to Dr. Sandhya's next question. Sort of's question is, which exercises we have to follow for swelling hand after the breast surgery? So swelling hand means the lymphedema. So he wants to know what exercises his mom can follow.
Is it the hand or is it the head?
The hand.
The hand. The
Yeah.
hand, it is the same thing. You see, the hand is one extremity. So the lymph has to flow up the arm into this. So it's again these nodes over here that need to be drained out first. So think about it like, say, when an accident happens. So they first have to clear out this area closest to the accident before the traffic in the far away can start moving, right? So this is the same concept. You have to first start to clear out this area first, and then this area next to it. And if the arm is swollen because the lymph nodes are compromised, you have to come from behind the arm. So you're actually going to be moving up everything this way and very slowly. And it's all coming, and you're going to drain it over here in this area right here. So if you have to turn the neck, you can see that how this hollow is formed over here. And that is where everything will be draining into the right right lymphatic duct. And if it's the left side, it's your left subclavian duct. And that is taking everything right back down into the heart. But it's very slow. And like I said, a person's hand is the best way of knowing how much you have worked or not. So about 15 to 20 strokes every time. And then you move down a little bit more and do the same thing. And again down till you start coming to the hand. And by the time you get to the hand, you can actually feel the person will actually be able to, flex their fingers and be able to wiggle them around and feel less pressure in the joints right there, right from the wrist to all the finger joints. They will actually be able to do that. And if they're not able to get to it, they can use something like a body brush. I don't have one with me right now, but they're usually a brush with natural bristles. But I always feel I don't have that with me either. So, but it's usually hand is the best because you can actually start to feel the softening of the skin happen. So when it is swollen with lymphedema, it can feel very tight, like something is overly full. But once you start clearing it, you can actually start to feel everything soften up and move. And it'll feel much lighter. They'll be able to move it.
Wonderful. Thank you so much, Renuka, for the great explanation. So this will be recorded. So I'm going to send the video too. So maybe, the way Renuka has demonstrated, you can go to the end of the session and also you can check it one more time if you have missed any steps for your mom. So hopefully that was really helpful for you. So our next question is from Dr. Sandhya, who is asking, do you recommend abdominal breathing as well?
Yes, yes. Yes, I do. Actually, why? Because there is a small part of actually it's not small, it's a major player in the lymphatics called cisterna chyli, and that is located in the abdomen. So that is why diaphragmatic breathing is so important. And actually, even before starting to do this 1, 2, 3 that I just showed you, if they can place their hands on the abdomen, say one hand on the diaphragm and the other hand just below the belly button, and just take three to five slow, deep breaths, that activates the cisterna chyli. And then that actually starts to help everything move down that much faster. So that is a great question. I absolutely love that. Thank you so much for asking.
Thank you. Awesome. So Dr. Sandhya, so thank you for the great question. To each of you for the great questions too. And so I think I'm getting a lot of requests, Renuka, for the video for our recorded session. So
Yes.
I'm going to send everyone, and even if those who do not understand English, even for them also, I think the way Renuka has demonstrated, and that's why we have the pictures that she has illustrated very well under the breast tissue lymphatic slide. So because the arrows and everything is very important, and that's why, even I think those pictures you can show it to your if so that everyone who doesn't understand English can also figure it out, because Renuka had also explained it. So the hand movements were equally being explained by Renuka very explicitly, very brilliantly. So it was great. Great, actually, Renuka. Thank you so much for the wonderful. I'm also going to practice from now on, because I never did that before. So
Yes,
it's
yes. And
wonderful.
I forgot to mention, Upa, but the reason why I'm so passionate about this is that I lost both my parents to cancer. So I am, that's why I feel very involved in this particular field, and I want to do something more than just massaging. And that's why I want to thank you for giving me this opportunity and a platform to speak out and to interact directly with doctors right here on your platform. So I thank you very much for that, and I'm always open to questions. You can email me, or texting is the fastest way to get my attention. And I always check constantly between clients. And we just want to we all want to just lead a safe and happy life, a productive life. And all I'll say is lymph moves very slowly, so please be very patient in whatever is happening, especially arm. It has to be done not just 15 to strokes in one area, but it has to be done at least 2 to 3 times a day for them to feel that. And so, but once it is brought under control, it doesn't mean that they can stop it. It still needs to be done every day. Maybe not 3 times a day, but at least 1 time a day, it still needs to be done.
Wonderful. Wonderful. That's great, Renuka. So do we have would you like to close, if you can, exit the PowerPoint, Renuka, then we can see all our audience.
Sure. Stop share.
Yeah. Yeah, so wonderful. So maybe if anyone has any more questions, do you can just it's open for discussion, so you can unmute yourself and directly ask questions to Renuka if you have any further questions. And I would really like to thank each of you here today for joining in from different parts of the world. And this session is going to be spread out. Even we have collaborated in Africa, different organizations. So that's wonderful that it's going to go all across the globe, in India, of course, and in USA also, in different parts. So thank you for joining in. And that's really, if you have any questions, and please, we will just give another few seconds if you have questions, or else I would like to wrap up with a thank you note. So it on pause. So if any questions, please unmute and ask our Renuka.
Hi, I have one quick question. My name is Baldeep. I'm calling from my question is one of my friend who was she got her lymph nodes removed, and after 3 years she got swelling, which is like pretty significant. And she was been going for physiotherapy, like to the lymphedema specialist. Still, it's under control with that, but doctors are suggesting that she'll need to go through surgery now, because it was not taken care in time. What is the surgery for? How do they resolve with the surgery?
I do not know because I have not seen this person. Now, is it a breast cancer that you're talking about?
Yes.
So is
Yes.
it the right side or left side? And for surgery, they normally don't suggest a surgery unless they do further tests, like say a mammo or an ultrasound or whatever. Did they do all that?
She has gone for scans, and then the doctor got the scan result, and they said she has to come and consult for the surgery. So I was just kind of curious, like if it's not taken care of in the beginning, does it get that worse that you have to go through the surgery?
No, something must have come up in those reports of the scans that has prompted the doctor to suggest surgery. Since I don't know the case, I really can't
Oh,
answer much
sure.
about this.
Right.
But
Make
lymphedema by itself is not a cause for surgery. Something must have shown up. And if the doctor has done his right thing by suggesting for the tests and scans and mammos and all that, and only then, they they have to trust their professional instincts and advice what to speak with the patient.
Sure, because I got a minor swelling too on where on the right side where my lymph nodes were removed. So I was just wondering, like, like I can follow your exercises. Thank you. It was very helpful and really very informative. Thank you for doing this for us. Yeah, yeah,
You just made my day.
yeah.
Thank you, Baldeep. So Baldeep is from New Jersey. So, and thank you, Baldeep, for your
Dr.
question.
Lopa, can I answer that question of Baldeep?
Yes, yes, absolutely, Dr. Rakesh. That's why it's an open platform.
So I assume Baldeep's mother has undergone a surgery for breast cancer, and she has developed lymphedema after 3 years. So what happens is with the usual exercises which you teach the patients after the breast surgery, sometimes the lymphedema may persist and they may start affecting their day-to-day life. So there are centers where they practice microvascular surgery where the breast lymphatics, which will be seen through the indocyanine green, will be anastomosed with the veins, or if there is any other lymphatic channels available. So some studies have shown that it has shown good results, and the edema has come down. So in fact, in some centers where they are doing axillary surgery clearance upfront, they suggest the patient that they have got microvascular techniques available where they connect
Yeah.
the distal lymphatics with the veins. So they have shown good results. So probably she may be advised in that lines. So probably that is what is happening.
um, like it seems like that's right because this is she's going to see a plastic surgeon for the
Yeah,
surgery.
it is done by a plastic surgeon because it's
Right.
a microvascular surgery. Yes.
Oh, got it. Thank you, Dr. Rakesh. Thank you.
Yeah, thank you. I learned something new. I knew
Yeah,
about the microsurgery, but this is a good thing to know.
yeah,
Why
Yeah.
yeah.
suggest it?
Something like some information, like in case it's good to have this kind of information. Yeah.
Yes, absolutely.
Yes, thank you, Baldeep. So thank you, Dr. Rakesh. So Baldeep, so Dr. Rakesh, they all are in a part of our support group that we have, the very private WhatsApp
Cool.
groups, and
Very,
have
very,
been always,
very
yeah,
knowledgeable. Yeah, yeah.
yeah, so that's we have a very great interactive experiences of the patients, survivors, oncologists, and others like coming up, nurses over there now. So that's wonderful. So thank you very much. Any other questions, or I would like to wrap it up because it's already 11:30 EST time, and I know it's pretty late in India. So, and if you have further questions, please reach out to me. I can connect to Renuka. And also those who are in Charlotte, those who are local, Renuka is from Charlotte, so definitely she's always there to help out. And thank you everyone today for your time, for your interest, and mainly please take it forward. When I publish the videos, please circulate among the groups, so that because that this is going to help with or without cancer. And I can see our research scholar Kavya in there. Thank you, Kavya, for joining in. And So that was wonderful for each of you today to come in, and a big thank you to our speaker, Renuka, for explaining in such details with your insights, with your patience in answering the questions and putting everything together for our BCH family. And we are so honored and grateful to have you here and have you as part of our BCH family.
Thank you.
Thank you so much. Thank you, everyone. Take care and bye, everyone.
Bye. Bye. Thank you.
Thank you. Bye.
Bye.
Bye. Thank you, Lopa.
Thank you, Renuka. That was wonderful. So I'm going to stop the recording now so that.
Yeah.